Good afternoon. My name is Nagwa Meguid. I am a professor of human genetics at the National Research Center in Cairo, Egypt, and UNESCO Laureate 2002, and jury president for young researchers in Egypt for Women in Science. The COVID-19 outbreak has made us completely change our modern behaviors. This pandemic is inviting me, especially, to become more real. I'm re-evaluating family relationships, work practices, and even exercise. Humanity's footprint on Earth is becoming so clear now. Spending more time with family altered personal freedom and potential changes in my job. How can we become more mentally resilient? During this period, I focused on the use of digital technologies, mobile apps, social media, wearable devices as channels to deliver intervention aimed at changing health behaviors. We cannot be physically together, but there are many ways to reach out to community through online activities with friends and family members. There is a growing appreciation for the value of science. We should highlight this, and we suddenly found out ourselves in front of this. Almost overnight, online teaching has become the new normal. Schools around the world is encouraging remote education to put first the health and safety of students, staff, and faculty. Many of children with special needs, as I am a professor of working with these children, are immune suppressed with other health complications, so their chance of catching COVID-19 is very high. And so life is now that schools closed and children are at home, so the life is very difficult for the parents. Many parents have been abruptly thrust into the full-time roles of teacher and caregiver while working their paying jobs from home. For my special needs patients, they are not going to get the therapists they need, and they should be socialized, but with some preparation, I think, and lots of patience, online tools will cover and will help us to get through this challenging situation. We are excited to share a video that shows how you can use social media to promote your work. I'm thinking that the impact of COVID-19 crisis is putting stress on families, relationships, systems, and healthcare providers, taking into account how there is increasing evidence of violence against women around the world, and mainly, especially around the Arab world. During this time of physical distancing and the requirement that people stay at home, thereby isolating women from their potential support systems. I used my time to start to write down a chapter on violence against women. This is one event, and on the other hand, I'm making physical exercise, starting to walk, and taking care of my food and the family food ingredients such as vitamin C to increase their immunity. In addition to online participation in international conferences, this is very important. And finally, I recommend that healthcare professionals should not judge patients on their cognitive ability when making life or death decisions. Thank you.